We are back with our esteemed doctor panel, and we have our regulars, Dr. Jill, Dr. Srini Iyengar, and Dr. Carm Sebastian, along with our special guest panelists, none other than Dr. Mehmet Oz.
Thank you very
much.
Guys.
Thank
you.
Hi.
Hi.
Good to have you all here.
Yeah.
Well, our first question is about the World Health Organization. They've announced 3 new deaths from a new virus that's worrying health officials in the Middle East and Europe. The organization has now confirmed 55 cases of what it calls Middle East respiratory syndrome, or MERS. 30 of those patients have died. Should we be concerned here in North America? Have you heard of this, MERS?
I have. I've been following it carefully. You know, it's scary because so many folks who get MERS die. It's a family of viruses that worry us anyway. And if I can just make some broad comment that my colleagues might disagree with, but I'd like to have the conversation. My friends who are leading the CDC, and other places in government are very confident that in our lifetime there will be a massive pandemic that will kill a lot of us. So when they start following things like MERS, it's not just a science experiment. It's because there is a likelihood that one of these might explode. We want to know about it early enough that we can begin to treat people before it begins to hurt a lot of us. So although this is, at this point, not in this country, it has already spread to Europe. It's a plane ride away from coming to this country. And when it does get here, we're going to want to know about it early on. Symptoms are, start off with a sore throat and upper respiratory stuff, and you get pneumonias a lot of times from it, which is a dangerous side effect. Carmen, have you heard about this as an internist?
Yes, I absolutely have. And I think the important thing is that it's very similar, the virus is very similar to the cold virus. It's a coronavirus. And I think we have to do what we do to prevent ourselves from getting the cold. So we're traveling a lot. Let's make sure we wash our hands. Let's make sure that, we're eating well and we're exercising and we're healthy to begin with.
And we want to make sure that people don't confuse this with MRSA, which is a hospital, usually a hospital-related infection.
Basically, that you get through. A lot of times in the hospitalizations, you'll pick up from being in the hospital from other people not washing their hands, but that hand washing is critical. It's really important to know that, hey, these 10 things can spread a lot of bad things. So you need to keep your hands washed, and if you are developing a cold or some type of infection, try to prevent it from spreading it by maybe wearing a mask or not traveling in a closed space with other people.
And could this have anything to do with using antibiotics when we don't need them?
No, it's not related to that. That's a whole separate big problem.
Okay, all right.
This is a virus that, again, they develop in other parts of the world first, so we get a little bit of a head start. But we need to track these carefully.
All right, let's talk about some beauty do's and don'ts during pregnancy, because I know a lot of friends of mine have done these things and they shouldn't when they were pregnant. Botox, hair dye, false nails, acne wash. Safe or unsafe?
Dr. Jill?
Botox, absolutely not. Hair dye, nails, I find it perfectly safe. Remember, in the first trimester, that's kind of when the baby's creating. And so if you can hold off during the first trimester, that's the best way to go. But it hasn't been shown to be harmful, and I go ahead and allow my patients to do it. Anything invasive, like the Botox, like fillers in the face, laser treatments. Remember, the body is immunosuppressed when pregnant. So those things can have an adverse reaction that you normally wouldn't have if you weren't pregnant.
How about those acne treatments and the different skin preparations we see?
That's great. I had that question yesterday, actually. And the truth of the matter is, the face washes with benzoyl peroxide you can use safely. Make sure you use antibacterial soap like Dial, Ivory, the safe ones, and keep healthy habits. Those are perfectly safe. I wouldn't take the antibiotics, obviously, like the dermatologist prescribe, or any real strong medications, but the over-the-counter are very safe.
I don't think you like antibacterial soap, do you?
I don't think it works very effectively, and it creates an environment where we get more of these resistant bacteria.
Why is that?
Because they kill off all the bacteria, the good guy bacteria, but we've got more bacteria in our gut than there are cells in our body, so we're mostly not us. So you kill off all the good guys, they're there to protect you, whether on a surface counter or in your body, and the guys who survive these antibiotic soaps and other treatments of that nature are the bad bacteria that we don't have good treatments for then. So it's much smarter to let the good bacteria and the bad bacteria fight the battle, and then you benefit because there are more good guys than bad guys.
All right, let's move on to sunscreen. We've all heard about the benefits of vitamin D. Dr. Oz, I know you've had a gentleman on your show that said, don't use the sunscreen and go out there and soak up those rays. And I know
I strongly disagree, just having been through what I've been through.
In fairness, that's not what he said.
Okay.
What he said was that he was concerned that some of the sun preparations, the protective preparations, are made from chemicals that have to be absorbed into your skin to be effective.
Okay.
So he was worried that they may actually cause harm to you because one of the most absorptive surfaces of the body, the skin, will take these chemicals into your body, and you would never allow these things to be swallowed. But you never drink suntan lotion, yet you absorb a lot of the contents when it's put on your skin. So what he said, and I think he's got a point here, is use the suntan lotions that are barriers. The zinc and the titanium products, and they're the ones for everyone to know. They cause a little bit of a white covering on your skin. In the old days, they weren't popular because of that, but the newer types of these protective sunscreens, they're made so well, they crush these little rocks up, the zinc and titanium so finely, they don't leave a white blemish on your skin, so they work for people of all skin colors.
And all the doctors are nodding.
Yeah, but real quick, Dr. Carm, wearing sunscreen all the time keeps she young?
Absolutely. It was a great study. And you want to put it on copious amounts. You want to cover all of your exposed body parts, and you want to reapply it if you sweat or if you go swimming. Yeah. And believe me, you know, we really need to do that if we want to look our best.
Well, you're 75 and you look amazing.
I use it all the time.
No, I'm just teasing. We're going to take a short break, and then we're going to be right back with more from our doctors right after this.